Hello, I'm Dr. Dee Apple, and I'm doing a presentation on October 7th on legalized pot. What are the consequences? And my presentation is going to be on the campus of Princeton University at Aaron Burr Hall. I guess I would start by saying that because I have probably half of my patients are teenagers or young people, the issue of the problems people run into smoking marijuana is a frequent topic of discussion in our sessions, and it has been for years. And so it's a topic that's close to my work and close to my heart. Done research, gathered research, and gone through it for years, and have talked about it before and written about it before, and I'm very interested in what's happening with the issues of legalization at this point. By far, the most harmful or destructive myth or fiction about marijuana that's becoming increasingly widespread is that it's no big deal, that it actually isn't harmful. And we know for a fact that it's perceived risk of the harmfulness of marijuana that deters adolescents from trying it or getting seriously involved in it. And so at this point, the perceived risk of using pot is decreasing in our adolescent population, and consequently their use is increasing, and that's of great concern. That is actually the substance of my whole presentation is what about medical marijuana and the possibility of widespread legalization of recreational use. In doing the research and thinking about this, it turns out that there really is no such thing as marijuana. There's so many different strains these days, so many different ways it's used, it's smoked, it's eaten, it's vaporized. The amount of THC in marijuana has steadily gone up over the years, and the other chemical component, CBD primarily, that has some medical use has stayed the same or gone down over years. So when you say marijuana, you have to be very careful what you mean by that, and I try to clarify that in my talk. And then adding the term medical just makes it more confusing. There's absolutely no reason for anyone to smoke marijuana in order to get a medical effect. Not only because of all the respiratory problems it actually causes. It's still not clear if it causes lung cancer, but the data is piling up that it's certainly a risk, but there's no doubt that it causes obstructive pulmonary problems, as well as some heart problems, metabolic syndrome, and some serious medical problems by smoking it. Not only that, but there is increasing research using CBD, the other main cannabinoid content of marijuana, and they're starting to come up with medicines, pharmaceutical medicines that are primarily CBD based, that do have some application for some medical conditions, primarily things like nausea when people are undergoing chemotherapy for cancer, and some applications for pain. However, there are other medications already out there that are probably just as effective or maybe more effective, I think probably more effective. And yet, the marijuana lobby has basically pushed the idea that there are a whole lot of different medical conditions that medical marijuana can be used to treat. And laws have been passed without research to support their application. For instance, there are several states that have marijuana laws that talk about treating ALS. There's not one study that supports treating ALS with medical marijuana. So part of my presentation is to talk about how the marijuana lobby has actually used medical marijuana as a Trojan horse to sneak in the whole idea of outright legalization of recreational marijuana. So as a result of, if you look at the research, there are tons and tons of studies, and I've basically decided there are three piles. There's a pile that thinks that marijuana is the devil's work, and it's the worst scourge on earth. There's another pile that praises its glory for all sorts of things like treating multiple sclerosis. And then there's a pile in the middle that's more rational, but you really have to know how to look at the research and look hard to find the more objective research. And consequently, we have a situation where smart young people, like I have a college student who came into my office. He was using marijuana with his friends and we were talking about it. And he said, "How can it be bad for you? Doctors use it to cure cancer." I said, "I don't think so." He said, "I saw an article where it said they shrink tumors with marijuana." And I said, "Pay you $50 if you bring me the article." Of course, I never saw it. But there's a lot of confusion. It provides a quasi-rational or objective reason to rationalize their use. So that's a big part of the talk. One of them is that not many people seem to understand the unique chemistry of marijuana and how that sets it apart from a lot of other substances that people abuse. Alcohol, for instance, as well as heroin, are water-soluble molecules. If you take some alcohol, we all make drinks with it, we mix it into a solution. If you took heroin and mixed it into water, it would go into solution. And if you drink alcohol, it is metabolized in about 8 hours. And even if you drank way too much the next day, besides having a hangover, there'd be no evidence in your blood that you had consumed a lot of alcohol. It's all gone. Marijuana is an oil-soluble molecule, and it gets absorbed into the fatty tissues of the body. And if you smoke regularly and you absorb a lot of marijuana or THC and their metabolites into your fatty tissues, it's there in your body long after you stop smoking. And it's slowly excreted into the bloodstream. And basically it's still affecting you in terms of your judgment, your coordination, to some degree your memory, your information processing, and all the ways that it affects you when you're actually intoxicated. Even if you aren't aware of it, even if you aren't intoxicated and have a subjective sense that you're high, and that is a pretty important thing. You can be high and not know it, or be affected and not know it. And there's some studies that demonstrate that very dramatically that I don't want to give away right yet, but they're very sort of shocking, how that effect happens weeks after people have been using marijuana regularly. One of the other unique contributions is that there's something about marijuana, and I can't tell you that I absolutely understand why it is, but I've seen it so many times that I know it is true, that marijuana does change consciousness. We know that. That's part of why people use it. But with changes in consciousness, it changes self-perception. And with that change, people lose the ability to accurately perceive their emotions the way that we usually do. Emotions tend, for some reason with marijuana use, to transform more into sensations. So people become kind of awash in sensations. They're paying attention to the bug on the wall and the dust in the sun and all kinds of sensations, the way things taste, the way things feel, the way things sound. But emotionally, they're not as aware of what they're feeling anymore because emotions have been transformed and they're less aware of them, and therefore less aware of themselves in their interactions with other people. And that's a profound and important insight. Well, in a lot of ways. I guess one thing that just first comes to mind is I'm old enough. I went to high school in the 1800s, and When I was in high school, nobody will believe this, and I have patients, I tell this, and they don't believe it. When I was in high school, I graduated in '69, and things changed dramatically right after that. But when I was in high school, hardly anybody drank, and nobody smoked marijuana. Just wasn't a part of the social life. I told a student that one time, and he was truly bothered by that. He said, well, what did you do for fun? Which is so sad. So we now have at least one generation, maybe 1.5, 2, who have grown up in schools and social settings where marijuana is constantly present. It's just there all the time. So they become desensitized to it. And with the legalization movement, that has become even more so. People just don't think of it as a big deal. We also have a generation of people who are now parents who smoked marijuana, and some of them still do. So I had a patient who came in one time and said, and he was in trouble about smoking marijuana, and he was dealing with that in his therapy. But before he really got cleared up and thinking more clearly, he said, I discovered my mother's stash this past weekend, but since this is confidential, you can't tell her that I'm smoking out of it. So my response is, I don't have to, you're going to. And so we met with her the next week, and he had to disclose to her, and of course she was very embarrassed. But she was bringing her son in because she was worried about his smoking marijuana, and she was smoking marijuana. So that unfortunately happens more often these days than you would believe. I think that with the medical marijuana movement, it seems like almost every week there's a new state that has passed a law legalizing medical marijuana. There are a lot of them now, including New Jersey, where we live. And with a few states also legalizing recreational marijuana, and clearly a strong movement towards legalization within all the states and pressure on the federal government to legalize it. It's just a really timely discussion about these issues. I mean, the whole point of legalization is based on the myth that it's not harmless, that it's not harmful. And that's just not true in so many different ways. So I guess one of my reasons for doing it is I'm offended by the lies. You know, I really am offended by the trickery of the lobby who's trying to get this done. And I just hope there are a lot of people out there who are curious and inquisitive and want to have an active discussion. There'll be plenty of time for questions and discussion at the presentation. So I'd like to have, I don't want to give up and assume it's just going to be legalized and be passive. This is my way of trying to address that issue. So I'm excited to do the presentation, and I really hope you'll come and be a part of it, and not just listen, but be an active part, ask questions and take part in our discussion. Hope to see you there.